Good afternoon, everyone. This is Dr. Smith, and this is Module C6, Occupational Health and Injury. We're going to go through a series of slides here, cover some learning objectives, a little bit of history and perspective, and then some specific details about why of occupational health, and also why it's important in public health. This is often an overlooked aspect of public health, but it's real and it's very pertinent to all the things we've been studying. So let's dive into the content. By the end of this module, you should be able to, or you will be able to, describe 4 events in the history of occupational health, discuss the significance of occupational environment for health and public health, list some of the physical and psychological or socio-psychological effects of occupational hazards and stressors, talk about 5 categories of health impacts of occupational exposure, and some methods for the prevention of occupationally related diseases. So occupational medicine is a branch of occupational health, or some might say the other way, that occupational health is a branch of occupational medicine, but this is a specific medical specialty focusing on the detection and prevention of diseases that arise from the work environment. We have a very wonderful clinic here at Loma Linda, the Loma Linda Occupational Health over on Commercial Road, right off of Waterman, where a lot of our employee physicals are done, employee monitoring, as well as the residency in occupational medicine training occurs. So what is occupational disease? Broadly defined as those health outcomes that are caused or influenced by exposure to general conditions or specific hazards encountered in the work environment. Why do we make this distinction? Well, there can be some very physical exposures that happen, very specific hazards, such as the potential for injury or exposure to some toxic chemical. But there's also general conditions that lead to stressors that can also influence our health. And so we're going to talk about some of those, and this is also reinforced in the readings that you have and some of the videos you have for this module. Occupational health is a very old field, and we know from written text and written records that occupational risks from mining were cataloged during Greek and Roman times. We also have catalog information from Chinese history and other places. And so we've been looking at these kinds of things. How does work and health interact for a long, long time? And there's some very noteworthy figures. And again, this is one of those rich histories that it helps us to understand. Some names you might recognize. Raziz used occupational classifications and medical case descriptions as early as 850 AD. Paracelsus, who we're familiar with from our study of toxicology, wrote a book on occupational disease. And Bernardo Ramazzini. Why is Ramazzini important? Well, he is considered to be the father of occupational medicine and therefore occupational health. He described in great detail the manifestations of occupational diseases. In his book, De Morbis Artificum Diatriba, published in 1700, he highlighted the risks of hazardous chemicals, dusts, metals, and other things that occurred in the workplace. We still use a lot of these. We reference this text a lot even today. Some occupational diseases in historical literature. And these are some things that I want you to look into. Miner's asthma, potter's rot, Mad Hatter's disease. You may remember some of these from our fall quarter discussions of environmental health. Fuzzy jaw and mule spinner's cancer. And we also have had several significant historical incidents which have brought the study and the focus on occupational health and safety to the forefront. Unfortunately, most of these tend to be tragedies, such as the Triangle Shirtwaist Fire, the Gauley Bridge disaster, and many others that we still have continuing today. The Triangle Shirtwaist Company fire was in New York City on March 25th, 1911. 146 women died. This was essentially a clothing manufacturing sweatshop in New York City. Poor conditions, using primarily women as seamstresses, and the doors were locked and the fire escapes were non-functional to keep the women at work and keep them from taking breaks and going outside during their work. The fire started and all of the women died, and this is one thing that brought, in the United States at least, the occupational safety and occupational health to the forefront. The Gauley Bridge disaster, covering a time span beginning about 1931 in the construction of this Gauley Bridge, where they were mining and digging through and placing foundations into geology that was had high levels of silica. And so in the boring and the digging and the excavation, very high levels of silica dust were created. This eventually resulted in about 1,500 cases of silicosis, which is a non-reversible pulmonary disease, and about 1,000 deaths. And so we look at these historical things, and I would ask you to think, as you're looking at these historical examples of things that have happened in recent history. There was an incident not too many years ago in a clothing manufacturing facility, I believe in Pakistan, and a number of workers died in a collapse and fire of a building. And so these kinds of things are not just historical, but they still happen in the world today, and we still have mining fatalities and other injuries occurring in occupational settings. There are many parts of occupational health and safety have to do with non-fatal injuries and illnesses. These are private industry reports, so as of about 2002. They're not really too much different, although the cases have begun to decline, at least in the US. But you see here that the numbers indicate that daily we have cases reported. In 2008, 3.7 million cases were reported. The leading causes of these are non-fatal, or and sprains and strains in an occupational environment. But we also, again, have to consider and must consider and understand now that both the physical as well as the psychosocial and emotional stressors are a real part of occupational health. Excuse me. The costs are enormous, and the direct costs of injuries and illnesses during 2002 were estimated at $45.8 billion. Indirect costs. So the direct costs relate to how much is paid out to actually treat and deal with these illnesses. The indirect costs are lost work time and other socioeconomic and social impacts, such as time away from work and lost time, that are a much greater cost to us. This is a huge area for public health, because all of us work at some point, somewhere, somehow, and the fact that our work environment has a big impact on the rest of our lives is something important from a public health standpoint. The leading causes of disabling conditions, as I mentioned, sprains and strains, cuts, lacerations, and puncture wounds, bruises, contusions. In 2008, a total of 71.2% of injuries took place in the service providing sector. So what is that? That is restaurants, hotels, manufacturing, a lot of just office related things where a lot of these injuries are occurring. Light duty, not necessarily construction or mining. When we talk about occupational health, we think a lot of times about physical and other kinds of agents such as noise, dust, toxic heavy metals, carbon monoxide, chemicals, radiation, microbial agents, particularly important in the healthcare setting, lifting injuries, repetitive motion injuries, other accidents that can occur in the workplace, such as vehicular collisions and things of that nature, but also work-related stress. We'll talk about the stress aspect of that a little bit more as we move through this. Noise, we don't often think about that from a health standpoint, but ototoxicity are any agents, both physical and sound-wise, that can cause or produce hearing loss or hearing deficit. These things include very loud noises and also several classes of drugs and chemicals that are used in the work environment. We know that toxic heavy metals exist in the work environment, and their fumes and exposure to these are not uncommon even today, with consideration of personal protective equipment and other measures to protect workers. We still have exposures, and we still have a resulting occupational disease. Carbon monoxide, we know, an odorless hazardous gas, causes death by depriving the body of oxygen. And so what are some of the places where we worry about carbon monoxide as an occupational exposure? Any place where there is enclosures, where there are internal combustion engines running, where there are chemical processes that might generate carbon monoxide. So enclosed environments with trucks, trains, automobiles, and things like that can be a serious hazard. As I mentioned, microbial agents are a particular source of health risk for workers in a lot of occupational categories. Healthcare workers, obviously, workers exposed to sewage, agricultural workers. All of these can be exposed to bacteria, viruses, and disease-carrying agents, and we'll have a little bit more this quarter on infectious disease and vectors and things like that. But you should understand that much of this is not just a general population issue, but it's very much an occupational issue as well. Work-related stress. This is becoming more and more to the forefront of occupational-related disease and lost time and injury. Chronic stress has been implicated in a wide range of conditions: coronary heart disease, mental disorders, and interestingly enough, the term going postal refers to employees who react to stressful conditions of their environment, that is their work environment, by committing violent acts. And many of you may or may not remember the incident where this was first coined, when a postal employee shot and killed a number of co-workers and supervisors because of the stress of the job of working at the United States Postal Service. And so this is kind of where that originated, but it's been broadly applied now to any situation from a work standpoint where stressful conditions can create such a response. We have a lot of occupationally associated diseases and conditions. Again, a lot of these are related to exposure to physical stressors or chemical stressors, allergic and irritant dermatitis from skin irritants, chemicals, respiratory disease from breathing dust and other things, creating chronic obstructive pulmonary disease and asthma. There are exposures to chemicals and other stressors, non-chemical stressors, which can have an impact on fertility, both male and female, and also increase the possibility of pregnancy-related abnormalities, hearing loss caused by noise, infectious diseases, musculoskeletal disorders, traumatic injuries and fatalities, and other conditions that are associated with job stress. And we start to think about these kinds of things in the context of, even if they occur in the work environment, do they remain in the work environment only? Well, clearly not. We all take work stress home with us. We can also, if we're in a situation, take work contamination home with us. And so it's a big area of concern from a public health standpoint, because everyone, again, works. And so the public health aspect of this is everyone is in some kind of environment where they're working and exposed potentially to these negative outcomes. They also can translate these into their personal lives or other social settings. And so it is a huge condition we need to be aware of. We can also talk specifically about those conditions, allergic and irritant dermatitis. This is truthfully, along with the physical injuries of sprains, strains, cuts, and other wounds, this is one of the most common causes of occupationally related disease and health stress. Manufacturing, construction, food production activities, metal plating, engine service workers, anything where we're using chemicals and where dusts are created can create a condition where you can have these allergic and irritating dermatitis conditions, especially if the proper protective equipment is not employed or the proper protective mechanisms are not employed for work protection. Respiratory diseases, clearly, many manufacturing and other situations such as agriculture or even healthcare settings, respiratory disease are a serious consideration. So you have everything here from asbestosis, coal workers, mining silicosis, bisonosis, which is related to cotton production, mesothelioma, lung cancer related to asbestos. These are some examples. Chronic obstructive pulmonary disease, or COPD, and asthma. This is a significant part of the respiratory disease state we see with occupational exposures. This is significant here. About 30% of cases of COPD and asthma can be linked to some kind of occupational exposure. COPD in particular is related to workplace exposure to dusts, but it can be chemicals, and it can exacerbate conditions where you have, say, someone who is already asthmatic. It can exacerbate that. If you have a population who are smokers, all of these exposures are additive or potentially synergistic with respect to pulmonary disease. And asthma has become the most frequently diagnosed occupational respiratory disease in the U.S. We still see this. This is not kind of a historical fact. This is still one of the most commonly diagnosed and commonly diagnosed, as well as complaints from occupational settings, is asthma either exacerbated or caused by occupational exposure. Fertility and pregnancy abnormalities, we have a total of 4 million chemicals that are used commercially that haven't been tested for these effects. These, particularly in women of childbearing age, but also in males with decreased sperm count or decreased viability of sperm, resulting in birth defects, premature birth, low birth weight, spontaneous abortions, and developmental disabilities. Most of the 1,000 chemicals, this is probably closer to 2,000 at this point, used in the work environment have been demonstrated to cause some kind of adverse reproductive effect in animals, but have not been evaluated in humans. Excuse me. So we think about conditions in the United States or other relatively developed countries where worker protection is at least more visible, available, and prioritized. But as we undergo globalization and the spread of manufacturing, there are a lot of places in the world where worker protection is not does not have the priority that we place on it in the United States, and so you have huge amounts of exposure occurring, and especially with a large number of women of childbearing age entering or being in the workforce, this is a significant problem. Hearing loss, we talked about ototoxicity. This is the second most commonly self-reported occupational injury or illness. And as many as 10 million workers in the U.S. suffer from noise-induced hearing loss. This kind of exposure to noise can also result not only in the physical hearing loss or hearing impairment, but you can have psychological reactions, and those can adversely impact the immune system, physical well-being, social interactions, etc. And so, again, one of those things is not related necessarily to a chemical, but can be related to many, many kinds of occupational exposures. So sound, we know, is produced by waves of various frequencies. The hertz denotes the number of cycles per second. And so we talk about sound pressure levels related in decibels. Most of you are familiar, at least to some level. And this is advantageous for us characterizing the types of exposure that people are related or are exposed to, in characterizing possible hearing loss. There are a couple categories of occupational exposures that are seriously affected by noise levels. Construction, this is one, and it's mandatory now in the United States and, again, most developed, economically developed countries, that hearing protection is provided in situations. But we also have exposures in the healthcare industry, from a variety of biomedical devices that are used with high frequency noise over extended periods of time. We also see, this is an interesting thing, that individuals in the music industry, especially those people involved in setting up and taking down the equipment or monitoring the sound equipment, also have noise-related occupational disease. NIOSH, which is the National Institute for Occupational Safety and Health, recommends an exposure level not to exceed 85 decibels in an 8-hour shift. And so if you look at some charts about decibel levels. This is not a really high level, and many times if you're caught in traffic or listening to loud music on headphones, you can easily exceed the 85 decibel level. And so from an occupational standpoint, this is kind of the functional level at which we start to see, if there is exceedance, we start to see hearing loss or hearing impairment. We talked about infectious diseases, and we'll talk in different modules and cross-cutting workshops in this quarter about infectious disease to more extent. But from this standpoint, infectious disease exposure from an occupational aspect can occur in healthcare workers, public utility workers, agricultural workers, social service workers and correctional personnel, clinical laboratory specialists, mortuary workers, and adult film industry workers. This is a huge controversy, the last category, huge controversy as LA and LA County are trying to regulate the adult film industry from the standpoint of public health and transmissible diseases, to the point where I heard something not too long ago that they were trying to pass a regulation that anybody involved in the adult film industry as the actors or the participants were going to be required to wear not only condoms but protective eyewear during their work activities. Musculoskeletal disorders. So this is one of the broadest and most common categories of occupational health injury. This refers to an injury or disorder of the muscle, nerve, tendons, joints, cartilage, or spinal discs. Now you can well imagine that this is a serious and prevalent condition in almost any kind of workplace setting. It doesn't have to be those settings such as construction or heavy manufacturing or any of those things. You can have that in an office setting. You can have sprains, strains, and tears, people who are unaware of proper lifting techniques, and just generally repetitive stress disorders. So any of these things can lead to this MSD category of occupational disease. In 2007, about 15 workers died. We're moving on here to traumatic injuries and fatalities at a different level. We had approximately 15 workers dying every day in the United States from traumatic injury. Now, this is not necessarily the catastrophic situation when you have a mine collapse or a mine explosion or a large fatal highway accident situation, but this is traumatic injuries and fatalities due to the job they're employed in. So a construction worker falls from a rooftop, or somebody gets hit by a swinging crane, whatever it can be. This can also be something as straightforward as a UPS driver involved in a fatal car accident. And so this is, while it's a smaller level than the musculoskeletal disorders, these are fatalities and long-term serious occupational incidents. What are the industries with the largest number of deaths? Construction, transportation and warehousing, agriculture, forestry, fishing, and hunting. I'm not sure why hunting is an occupational kind of thing, but clearly construction, transportation, warehousing. The one that does not appear here is the oil and gas industry, so oil well drilling and exploration does contribute. Mining contributes significantly to numbers of deaths from an occupational disease standpoint. When we talk again about the less physical aspects of occupational disease, we start to talk about job stress. And here we want to talk about things that are both physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, the needs of the worker. So job stress can range from anxiety, stress, neurotic disorders, all the way to going postal. And so there's a wide range of things here that we associate with job stress. We also have to think about things like unemployment when we're talking about public health. And so unemployment, it's not a directly occupationally related, but it is an occupationally related disease that can cause significant psychosocial as well as socioeconomic stresses. And so typically we'll think about the critical incident stress, and of 6 job categories that have the highest percentage of anxiety, stress, and neurotic disorders, we see things that are definitely not physically related, but rather technical related. Sales and administrative support had some of the highest levels as measured in 2001. All of this leads us to the fact that there are stresses and disease potential and danger in any kind of occupation. How do we prevent these? For most jobs, because the threats or the risks are physical, the primary prevention techniques are engineering controls, or modification of work practices, or administrative controls. And so we see, machinery being quieter. We see education in safety and training. We see administrative controls such as changing work shifts or rotation of employees to minimize these kinds of stress. From a physical standpoint, personal protective equipment are those things designed to protect employees from contact with chemical, radiological, physical, electrical, mechanical, or other kind of physical workplace hazards. Personal protective equipment will not do much to reduce the psychological or psychosocial stresses associated with work directly. Primary prevention versus the use of personal protective equipment. So if there's adequate ventilation in a building, it may reduce the need for more stringent levels of personal protective equipment, but those things have to go in combination to reduce the physical hazards of disease in occupational settings. Some of the examples are respirators, earplugs to protect against hearing impairment or hearing loss, protective eyewear such as goggles, face shields. We also look at situations where full body protection is required in the form of like Tyvek suits or other kinds of full body protection. Again, these are all physical, designed to protect against airborne hazards and to an extent infectious disease hazards. Public health surveillance systems include the collection of information about all of these occupational injuries and illnesses and are maintained in databases by agencies such as NIOSH, the National Institute for Occupational Safety and Health, OSHA, the Occupational Safety and Health Administration, MSHA, the Mine Safety and Health Administration, as well as the Bureau of Labor Statistics. Some of the things in particular that are operated by NIOSH. NIOSH is a non-regulatory branch of the government. It is not part of OSHA. It's a separate independent research group funded through, I believe, Department of Health and Human Services. But they also maintain, it's in some ways similar to the Centers for Disease Control, but focusing more on occupational issues. So the National Surveillance System of Pneumoconiosis, traumatic occupational fatality surveillance, and other things that monitor, survey and gather data on occupationally related disease. NIOSH also sets exposure limits, which are, again, non-enforceable regulatory guidelines, but they are followed very closely. OSHA also has a set of its own standards, as well as EPA, where the protection of the environment overlaps occupational settings. These are typically characterized as a threshold limit value or a time-weighted average, which is amount based on health effects, typically, that a worker can be exposed to over a work period, whether it be an 8-hour day or 5-day-a-week work week, and refers primarily to airborne concentrations of substances. There are also levels that are set for dermal exposure. There are levels that are set for noise. There are levels that are set for radiation, infectious disease, magnetic fields, et cetera, et cetera. And so all of these are monitored, and employers are held accountable for showing that they are achieving protection at these levels, if not better, for any workers who are potentially exposed to these things. And so this is a brief overview of occupational health. The readings and the other videos will give you a lot more information about that. It's a broad field, it's a wide field, but it is definitely a field that is also public health. And if you are in practice in any kind of specialty area, global health, epidemiology, I don't care which one, occupational health and safety can have a big impact on your population. We think about workers in general as being exposed at work and then coming home and separating those two, but in fact these are inextricably tied to each other. We have to think also about sensitive or underrepresented populations. So farm workers comes to mind as a perfect example of underrepresented populations where, because maybe of their immigration status, if you're talking about migrant farm workers in the U.S., socioeconomic standards, educational levels, et cetera, they can be particularly vulnerable populations. And this doesn't have to occur only in agriculture. We think about recent activities that have gone on to regulate nail salons throughout Southern California and many other places in the United States against occupational disease in the form of not only exposure to chemicals, but unfair or unreasonable working hours, pay levels, all of those things go into occupational health. And so from a public health standpoint, this is very relevant, pertinent, and something that you need to be aware of. The last slide is just a poster from American Public Health Association celebrating in 2014 their 100th anniversary of the Occupational Health and Safety section. You also have a video that goes over this and has some really salient facts, but you'll see just even in this poster, there are a lot of things that we consider to be occupational health, occupational safety, and it is very much a public health concern. Thanks so much.